People are like, you look so, what's wrong? Is everything okay? And you're like, no, just my face. And
Right.
why is it just our face, right?
Yeah.
So we wanted to talk a little bit, I guess, about like what are the first signs of aging in the upper face?
Yeah, so aging is very sequential, starting in our 20s, and we start to see some subtle changes that occur in the face. And I guess the first thing that happens is our skin starts to age a little bit. We start to etch in some dynamic lines that occur in the upper face. So typically the 11s that people complain about so much, those are caused by muscle movement and sort of aggressive movement like this, that our skin is, we're making these expressions, raising our eyebrows and so forth, and just doing this repetitively to our skin and then etching that line in.
Hmm.
That's probably one of the first signs that we see. And, those lines can make us look a little bit worried, a little bit concerned, maybe not so approachable.
Yeah.
Mm-hmm.
And well, what can we do about them?
Well, we want to stop that movement, right? So the commonest, one of the more common aesthetic procedures that we do in the clinic and generally worldwide is Botox.
Hmm.
Botox is a very well-known neuromodulator. I mean, there are others. There's Dysport, Xeomin, and now there's even a newer one on the market that will actually stop muscle movement. These neuromodulators are basically proteins that bind to the muscle and will stop it from responding to the neural impulse that says contract. So you get rid of that movement and then you allow the skin to remodel and repair those lines that are etched in. And so often we say skincare and skin health is fundamental, and that's why, right? We're really depending on your skin to remodel itself.
Yeah. And
Yeah.
what do you say to patients that say, well, then I don't want to look not like myself, what are some of the ways to explain that? Because I think everybody's things in Hollywood that are a little terrifying. And I think that's the biggest, and it was for me for sure. It's fear of looking unnatural or fear of not being able to animate.
Yeah, so Botox, just like everything else, can be used judiciously or heavy-handedly, right? So it just depends. So we have a few patients that want no movement in areas, and then others that want to have movement and need to be able to express themselves specifically. And so you can moderate the dose. You can not use so much. And if you have good knowledge of anatomy, you can make sure that you're really eliciting a very natural look. Um, Balancing Botox in here with Botox in here with here, so it all looks very cohesive, and you're not over treating one area or another so that it looks unnatural.
Yeah. And it's when should people start that? Because we see people starting sooner and sooner, right?
I would say, I think for Botox, there's really no harm in starting, say, in your 20s. Um, you can wait a little bit, but what will happen is that you may, depending on what your skincare is like and what your sun avoidance and your sunscreen use has been like, some people will start etching those lines in when they're 20 and others when they're 30. So when you start to see that even in a relaxed state, you're seeing that faint line, that would be a good indication that you want to start using Botox to repair that. So for some people, that'll be sort of mid 20s. For some, it'll be in their 30s. Um, and, we usually say do Botox every 4 to 6 months. Um, but, any break that you can give your skin from having this done to it repetitively, you're going to benefit from.
For sure. And then what happens beyond that? So once we start to see, maybe we get Botox, we still feel like we look tired, you know,
Mm-hmm.
on there.
Yeah, in our 30s or mid 30s or so, we'll start to have people say, Botox used to work really well for me, and I felt like I looked refreshed, but now I still feel like I look tired sometimes, or I don't feel, I feel like I'm still a bit droopy. Oftentimes, that is a good indicator that they're starting to have some volume loss. And one of the areas that is very um, sensitive to volume loss is the lateral eyebrow. And
Mm-hmm.
you'll start to have people have these little lines right up and through here.
Do you
Very
want,
easy.
you want to see mine? Okay, I'll leave.
Let's see yours. Yeah.
Can you see it? It's right there.
Yeah. And you can see it progresses right up and through here.
Mm-hmm.
And people will come back and they'll say, "Can you get that with the Botox? It's if the Botox isn't working." And we
Mm-hmm.
explain to them, like, yes, we can. We can soften that, but we can't stop it entirely because Botox works by stopping muscle movement. So this area is being lifted by this muscle. If you want me to stop that muscle, guess what happens, right?
That's a good look.
Yeah. And so we have to explain to people that this little line here often is one of the first indicators that you're having some volume loss in the lateral aspect, right? And through here.
Mm-hmm.
And really the solution is going to be maybe using some filler in the temples and you can lift, or if they've got some volume loss right up in the forehead, up and through here, we're going to need to use some filler here.
And I think it might be good just to reiterate the difference between a neuromodulator like Botox, filler like
Yeah.
Jupiter.
Right. So Botox is a neuromodulator. It's just a protein. It's just water with a bit of protein, or saline with some protein that we're injecting. And that protein is a very, very small molecule. It's just binding onto the muscle and it's stopping that muscle from reacting to the nerve impulses to contract. Filler is like a jelly. So we typically, the commonest fillers that we use are going to be hyaluronic acid based fillers. Those, there's various brand names. We carry multiple types so that we can really match the patient's tissues and the area and the depth of injection that we're doing with the filler that's going to suit that person best. So it's never really about the filler per se, it's about how it's injected, I would say.
Yes, I would agree with that.
So hyaluronic acid is a jelly, clear jelly-like substance, and it's naturally found in our body. And a lot of people don't know that. They think it's some kind of, unusual thing. But hyaluronic acid is found in our body. It's the goo that's in our eye. It's within our joint spaces, and it's been used in medical applications for over 30 years. We use it for osteoarthritis of the knee and other joints all the time. It's just branded differently. It's called Synvisc is one of the brands that. Or I think it's Vitrace that you use for eye surgery. So it is used in other medical applications, but it's a jelly-like substance, and it replaces volume because volume is another key factor in facial aging. When we start to see the underlying skeletal structures.
Mm.
And I thought this would be a good time to introduce Pat to everybody.
Yeah, I'm so proud, Pat.
Yeah, Amanda named Pat.
We don't know. We had to come up with something. I have to name.
Yeah. So this is Pat, and we're going to use Pat to show sort of some of the underlying skeletal aspects of facial aging. But we age from the skin to the skeleton, and then our fat pads as well. So I mean, as you age, you'll start to become a little bit more skeletonized. You'll start to see some of these underlying structures, like right in through here.
Mm-hmm.
Commonly, when we talk about upper facial aging, we often will see a slight change in the contour of the upper face, forehead, from an oval sort of shape to a more peanut shape, where you start to see this indentation. And this little pad here, this volume loss here, is what will cause that little droop of the lateral eyebrow. And you can see it's sort of, connected to the orbital soft tissues too. So as you start to lose a lot of volume in through here, our orbit seems to sink. It starts to look sort of sunken, less bright. And then you start to get volume loss down in here too, right?
Mm-hmm.
So if we replace volume and if we use Botox, we can actually delay, people's need or their feeling like, oh, maybe I should get an upper lid surgery or something. If we're preventive, if we're using Botox, if we're losing volume, we can sometimes delay that need.
Yeah, for sure.
Especially if we marry it with some like laser treatments like Halo. We use Halo or Morpheus to really tighten the eye tissues. And we can restore quite a bit.
Yeah, it's pretty amazing. And not everybody is, keen to go under them.
No.
And there are anything. There's risks with everything.
Hmm. I always the eyes are so key to our identity, right?
Yes.
And upper eyelid surgery, I think, is pretty easy. It's pretty safe, and a lot of people opt for it and are usually quite happy with it. It's often the lower lid, the lower eyelids that are trickier.
Yeah, I've
Lower
seen
part of the face, right?
it almost changes who they look like.
Sometimes,
Yeah.
sometimes. And just like any procedure, if you're going to choose surgical procedures of your face or eye, you want to make sure that you're working with someone who does them day in, day out, day in, day out, and
Mm.
really, keen on preserving the shape of the eye because that's what makes you look like you. So that's more to do with here. So the under eye area is so common as well. People will say, I look tired under here. This is fine. And, we've done Botox, but this is it's starting to bag out. Why
Hmm.
did that happen? Well, funnily enough, this temple volume loss will actually impact here because the eye sinks back, and we also get loss of the fat pad that sits here, and then this little orbital rim starts to show a little bit. You get more delineation of this rim, and people start to have that sort of baggy look. And so when you replace volume here and here, it actually improves that whole area. And very, very often we don't have to go into the tear trough itself.
Yeah, that maybe it might be worth talking about that sort of why tear troughs are so tricky. I mean, they can be fabulous, but they can also end up with complications, right?
Yeah, it's a tricky anatomical area. There's a confluence of various fascial layers there, and there's in particular, I often will see people who have swelling in this little malar mound here. There's this little fascia that attaches in through here, and if you get filler, which tends to draw water into here, sometimes you'll get intermittent swelling in through here. So if we can avoid tear trough fillers, we try to. Sometimes
Hmm.
we do, and so we just need to be judicious and use a very small amount at a time.
Right.
And
Yeah, and that's what I like about your approach is that it's, you're a physician first. So it's about trying to meet people's aesthetic goals, but in the safest
totally.
way possible, right?
Yeah, I think that's really, really, really important to keep safety paramount and first, right? So if we have someone who has swelling or intermittent swelling in that area and they have a lot of tissue laxity there, then oftentimes we'll actually steer them towards tightening technologies, and we'll use our Morpheus 8, which will just really tighten that area wonderfully. Or if there's more textural concerns, then we might say, well, Halo would be great. You just have to be prepared for a little bit of downtime. So knowing when to use your tightening technologies, when to really focus on volume replacement and where is really key to optimal results.
And then I think I mean, as much as we're focusing on the upper face, it's cheeks, right? Cheeks play such a role in
Yeah.
supporting the tear trough. Would you agree?
Yeah, absolutely. So when that cheek starts to drop, you'll see that orbital rim more, and it just gives you that tired look. I mean, even if I just do that side of my face now looks a little bit drooped, tired, not
Yeah.
quite right as the other side. So that is what happens with the cheek. And I often will say that everything's sort of connected, and we're almost like a balloon with a sheet over it, and that air is slowly being let out over time, whether it be volume loss in the calvarium or everywhere else, your skeleton, your fat pads, and it's just doing this, right? So
Hmm.
this starts to droop and lose volume. Guess what happens down here? We get excess, right? And we'll go into that next week a little bit more, but this is connected to this is connected to this. So yeah, we're talking about the upper face, but it's all connected, and it's all adding to that feeling of looking either tired or saggy, right?
Yeah, which makes them to feel older, right? It is all that every little line, if and and that's why we're not always going to be chasing every little line, right?
Yeah, it's about that whole like sort of impression. You know, when you learn to paint or sketch, one of the exercises that you sometimes do is sometimes called gestalt or gestalt paint or gestalt gestures, right? You try to capture a feeling or a mood very quickly just with a few lines, and it's that first impression that really sometimes is so important. So we encourage people to sort of back up and look from a distance. It's so easy to get close and just focus on those little lines and forget what's the overall impression, you know?
Yeah, and I think that's where the clinical is helpful when we're doing a consultation. We do those photos that, we get the hair to disappear, and we do, you know, animating and but also just in a neutral position. And I think that's often very helpful for people to look at themselves a little bit more objectively
Yes.
because we all sort of mug for the mirror, right?
Yeah, exactly.
That
Yeah.
kind of,
So
yes. I say cheeks are kind of like the hanger for the face. They're pretty important, but just as important, I think, is temple.
it is because the cheeks have to, it's so cheeks went through a bit of a heyday, I would say, a year or two ago, and the key is really making sure that they're attaching to the rest of your face. So,
Yeah,
big cheeks that don't really visually fit with the rest of the face won't really help you look more youthful, and they certainly won't be natural. So they have to be proportional and appropriate for the remainder of the volume. And so temples actually lose volume very early on in the aging process. So we often will be using temple fillers along with cheek fillers and making sure that your cheek filler is sort of connecting to the rest of your face. So it looks natural and natural with movement too, right?
totally. And I think that, when we go on to the lower face next week, it kind of makes sense why we always want to start or at least assess upper, right?
Yeah, absolutely.
Yeah,
Yeah.
because the goal isn't to make people look strange or unnatural. The goal is to sort of put volume back where they used to have it,
Yeah.
right? And even sometimes we will treat much younger that maybe have a sort of a genetic um, thing that's kind of bothers them, like for short chins, for example, right?
Mhm.
Where you
Yeah,
can
some
sort of
people just have an Achilles heel or a certain area that will age them a little bit more than others, and so you might have a younger person that benefits from, some replacement or augmentation in certain areas. But yeah, you want to replace things that have been lost so that that person looks like themselves. We just did a case last week when we finished. The young lady was like, "There I am. That's me."
yeah, that
That
was awesome.
that was awesome. Yeah,
And again, she looked like her. She's just like it probably looked like her 5 years ago.
that's right. That's right.
Like that.
Yeah. So I don't know if anyone has any questions about the upper face and aging and tired eyes, but the solution is sort of threefold. So addressing the skin, addressing some volume loss, and addressing some lines or dynamic lines that might have developed. And so, using a comprehensive approach or a holistic approach, we always talk about, is key to that natural look. So, um, next,
And
we're going to be talking about jowling. That's another common um, concern for sure. So,
yes, I'm excited.
yeah. I'm excited too. So if anybody has any questions, just message us or email us at our info email, and we'd be happy to answer those questions for you next week. Otherwise, we'll see you next week.